Okay, so when something is creamy, it means semen is actually creamy. Neither is it thick, neither is it a lot of watery substances. It's something like a semi-thickness aspect. Okay, so it means if somebody ejaculates and then you see the semen to be yellowish and thick, what do you think is wrong with the person? A yellowish and a thick semen. What do you think is wrong with the person? Okay, so the pathway of the vas deferens is also important, especially at this crossroad. I said, remember, the pathway passes anterior to where the ureter joins to the urinary bladder. So if somebody has kidney stone, it's a fragmentation coming from the kidney. Remember, it will be stacked between the ureter and the bladder, and that compress any other thing that is anterior to it, including the vas deferens. Okay, so in that case, it means that there's going to be a blockade of the sperm pathway into the prostate. Okay, so from the vas deferens, you come to the ejaculatory duct. The ejaculatory duct is the meeting between the seminal vesicle and the vas deferens. The ejaculatory duct is a small pathway that enters into the prostate. Okay, it enters into the prostate and opens into the prostatic urethra. Remember the secretions. The bulboureterian gland, on the other hand, is not does not secrete into the semen. What it does is that when a man gets erection, it is the substance that will be produced, the alkaline, slimy substance that will be produced to clean the pathway of the urethra. That sticky stature that is anterior to the penis in erection, that is the secretion of the bulboureterian gland or the carpal gland. It cleans the pathway and makes the pathway very slippery to allow the semen to be able to swim into that aspect. Okay, so these are the three accessory glands. Know what each of them does, and let's throw more light onto the clinical aspect regarding the vas deferens. The vas deferens clinically can be used for vasectomy. Vasectomy is just a family planning method when the vas deferens is cut to make sure that the sperm cell cannot travel from the testis to the ejaculatory duct. Okay, and then we can also have hematocele, which is the swelling due to effusion of blood into the tunica vertebralis. We can also have fluid at the end of the sperm. We call it spermatocele. We also have cysts at the epididymis. We can have varicocele. We can have testicular torsion. We can have inflammation of the epididymis and an ovum inflammation of the testis. So these are the pathway clinical relation when it comes to the epididymis. Let's throw more light on the prostate. As I said that the prostate secretes around 30 to 40% of the fluid into the sperm aspect. It's something like a fibromuscular organ. It lies just beneath the bladder. It is unique to only men. It's only men that have prostates. Females don't have prostates. Okay, and remember, from it also opens the urethra, opens into it. So it means that when somebody is going to urinate, they usually pass through the prostate first. So we have prostatic urethra, before membranous urethra, before the pineal urethra. This is around 12 centimeters in length. Okay, the prostate too has two parts. We have the central part that's made up of 25% of it, and then a peripheral part, around 70% of it. Benign prostatic hyperplasia, which is enlargement of the prostate, usually happen in the central part, while cervical prostate cancers do happen in the peripheral part. So it means that if we have BPH, benign prostatic hyperplasia, it means that where the urine passes will be a bit close. So it makes it difficult for the gentleman to urinate. So at times a catheter has to push through, or at times a surgery has to be done to remove one on the lobe to allow free passage of urine. Okay, so we have inflammation of it. We have benign prostatic hyperplasia. We have inflammation of the prostate. We have removal of the prostate and also cancer of the prostate. Remember, for the cancer, it starts from 40 years and above. When a gentleman from 40 years and above should be able to have his prostate screened in two ways. One, by doing a PSA test. PSA is prostate-specific antigen. Okay, the margin of it will determine either you have a cancer or not. Or also take a scan of your prostate to be able to have a bladder full of urine, urinating with another scan is taken. So before and after, so that we can know that is the prostate big. If big, does it affect or impede the pathway of the urine or not? Okay, so once a year, when that is done, gives a man the way forward. Okay, so from the prostate, I'm going to jump straight into the penis. But with the penis, remember, the penis is not a vital organ. I will repeat that. Vital organs are organs in the human body that when it's removed, the person suffer, okay? Or the person dies. For instance, if your heart is removed for liver replacement, you die. So the heart is a vital organ. If your liver is removed, you also die. The liver is a vital organ. The penis, gentlemen, I'm sorry to say, is not a vital organ, okay? So you can remove your penis, you won't die, okay? It's not a vital organ. So be careful the way you are holding your penis and everything. And remove. But this penis has parts. It has a root, a body, or the shaft. Okay, the roots stick to the pubic bone, and then the body is the prolonged aspect. I will go. You see, with the penis, there is a cross section of it as shown in the screen. Okay, when you take a cross section of the penis, it shows different structures. Let's look at the internal structure first. The internal structure here shows 3 arranged structures. 2 of them are called the rectal tissues, okay? They are called actually corpus cavernosum. And then the one beneath it is corpus spongiosum. The spongiosum contains the urethra, okay? And the cavernosum are the rectal tissue. This is a special connective tissue. So the penis can fracture all right, but there's no bone in the penis. So the penis is made up of a special type of connective tissue. And then if you look deep into that, we can see arteries. And then when you bypass the deep fascia is that white structure that goes around the bodies, the corpus cavernosum and spongiosum. We call it deep fascia or Barclays. Okay. Now, when you go beyond it, we can see connective tissue, fats, and then veins. These arrangements make it so that every blood vessel you see in an erected penis is a vein. Every blood vessel you see on a erected penis is a vein. It's not an artery. So in case of priapism usually is a condition that can actually happen to sickle cell people or in certain conditions. It's constant erection. You can use this vein to deflate the penis. So remember, these veins are usually within the skin aspect. So if you look at this cross section, these veins are within the connective tissue. So they are usually shown on the penis. But the deep arteries here are in the erectile tissue. So let me take advantage of this to explain why early morning a gentleman will wake up with erection. You see, when you sleep, we have organs that still work. The heart, the lungs, the brain, kidneys, they are still working whilst you are asleep. They are doing their work. The heart is pumping blood, and then it will fill all arteries, including the arteries in the erectile tissues, the deep arteries. And then the kidney is also trying to take toxic substances from your body, pushing them to the urinary bladder. In these cases, it means that if a gentleman sleeps 6 hours or more, by that time, the kidney and the heart will be doing their work. So it means that more blood will be pumped into the erectile tissues for erection. And now, why is that the penis has not got flappy? The veins that need to drain the blood from the erectile tissues, a group of them are hidden beneath the urinary bladder, the plexus. They are hidden beneath the urinary bladder. So it means that once the heart has pumped blood into the erectile tissues, the kidney too has worked, so it has pushed more urine into the bladder. And when the bladder is full, it compresses these veins so that the veins cannot do their work well. So this gentleman will wake up and has erection unless he goes to the washroom to urinate. When he urinates, then the load on top of the veins has been released. The bladder is empty. Then they can go and drain blood from the penis. So that's why after urinating, is then that gentleman's penis becomes flappy. Okay? So this is a phenomenon that happens to every man, young, old, everything. When you sleep 6 hours onwards, this is what happens. Not every man per se. Those on medication, those hypertensive, diabetic may not experience that. It's as a result of the drugs and environmental factors around them, the diet and everything they take. Okay, but normally that's what's supposed to happen. So have a good look of the cross section of the penis. The external aspect is the skin. The skin extends to the gland. So the skin that covers the gland of the penis is called the prepuce or the foreskin. In circumcision, this skin is removed and then exposing the gland. Okay, so it has a gland, the coronal parts, the shaft or the body, and then it has a root. And this is what happens in the cross section of the penis. Okay, so I've already talked about circumcision. We have paraphimosis, balanitis, and papism. I've also talked about papism. Find the other two conditions there and then know what they do in terms of the penis. Okay, so with the gentlemen, a quick revision of the male reproductive system. We talk about the testis, the descending aspect of it, the side effect. When it doesn't descend, how do we call it, and the condition and what to do. We also look at the tactile pathway from the epididymis down to the vas deferens, crossing over to the ejaculatory duct. And we also look at the conditions related to it, the clinical aspect of it, and then we've looked at the prostate, one of the main accessory glands in details. Remember, semen is what comes out of a man. And then the contribution of the fluid is 70 to 60% for the seminal vesicle, which is whitish and thick, and then 30 to 40% by the prostate, which is whitish and acidic. Okay, and then we know that the bulbouterine gland or the cowpea gland is a cleaner. It cleans the urethra, a slimy, sticky substance, a base substance that cleans the urethra before ejaculation. Okay, and we want to talk about the penis, a cross section of it, show us the erectile tissue in the middle, and the periphery, the fatty and the skin aspect. Blood veins are found in the connective tissue, and then in erected penis, the arteries that we see and the blood vessel we see are actually veins that can be used in papism and other conditions. And then it is the artery that fill the cavernous body, and it's the vein that drain it to make it flappy. We've explained why a man wake up in the morning and have constant and you have erection. Unless he pees or urinate, then becomes flappy. Okay, so that's a quick revision of the male reproductive system. Remember that we also look at the through and fore pelvis in the male reproductive system. We saw that the rectum and the urinary bladder are the true organs of the pelvis. The space between them we call the recto-vesical pouch or space. Okay, and then we saw that we can some organs like the intestines are found at the first pelvis. Remember, the muscle arrangement is also important to take note of that. This, ladies and gentlemen, will take us to the female reproductive system. With female reproductive system, if you look on the screen, the most important part I'm going to talk about, we're going to look at the female urethra, the uterus, the position of each uterus. We're going to look at the quick anatomy of the vagina, and then the hymen, the mons pubis, labia majora and minora, the clitoris, and the vestibule. Okay, so this is what we're going to look at it. Without wasting time, let's go straight. On your screen, what we see is the lithotomy position. This position is preferred by the midwives in delivery. Okay, this one is their work. Okay, so the lithotomy position, this is where, so the structure you see in the lithotomy position is what we call the vestibule. So this is the vestibule. The hairy area here is the mons pubis. It's only in females. Men don't have mons pubis. Take note of that. It's only in female. Is the pubic symphysis that is padded by fat. So find out what is the function of the mons pubis. Okay, and then when it comes laterally, we have the labia. Labia means lip-like. So we have the lip-like structure that is big, the lip-like structure that is small. So labia majora, labia minora. The majora and the minora, the difference is that the majora contains a lot of hair follicles or hair. Okay, why is the minora devoid of hair follicles? Okay, very pinkish or very vascularized in nature. Okay, on top of the cleft where the minora meets, we have the clitoris. The clitoris, the homologous structure of the men penis. So whatever happens in the penis, erectile tissues and everything are also present in the clitoris. Okay, good. So the length of it is very tiny or very short as compared to the penis. Okay, So this is the sensitive area. Clinically, if you locate the clitoris, beneath it we have the urethra, the pathway or the opening of the urethra of a female. The urethra of a female is approximately 4 centimeters. Unlike that of male, that is 12, it's very short and straight into the urinary bladder. It has just one pathway. Unlike the men, that we have the prostatic urethra, the membranous urethra, and the pineal urethra. Here, just one urethra into the urinary bladder, 4 centimeters. Okay, so the clitoris should be a guideline to be able to locate the urethra. The pathway of catheter for urethra happens in CS, cesarean section repart, when the lady is hospitalized and cannot move. We pass a catheter, should be able to ease herself easily, or those unconscious, we pass catheter. So please, when passing catheter for a man, it's straightforward. Penis, meatus, we enter. But for females, the guideline is that the clitoris, beneath the clitoris, there's an opening. Please take note of that. Okay, so this, from the clitoris, we see a particular structure. That is what we term as hymen. So on the screen here, we have the different types of hymen. Okay, 1, 2, 3, 4, the types of hymen. This is a lunar hymen. Is the lunar hymen, one hole, okay, septated, just like a septa between it. And then we have the clariform, like small holes, clariform pit, clariform hymen. And then we have the parous intrus type of hymen. These are the type of hymen seen. But there are so many controversial aspects in terms of the hymen. Okay, so many controversial. In Africa here, we don't usually see hymen. Why? Because of the way we bath our baby girls. Okay, pouring water into it. These baby girls, usually in their early age, are very active. They jump, they take bicycles, they climb trees and everything. They wake up. These timing are very tiny structures, destroying it one way or the other. Okay, so the way we bath baby girls in Africa here tend to destroy their hymen. So you should take note of that. So this will take us straight to the vagina. As vagina is a fibromuscular tube around 10 centimeters in length. The space between the vagina, the orifice of the vagina, and that of the anus, that the urethra, is very close. So if you look on the screen here, this is the opening of the vagina, and this is the opening of the anus, and then this is the opening of the urethra. These openings, if you are not careful during wiping, when you visit the washroom, can transmit microorganisms from the anus to the vagina, or from the anus to the urethra, or from the urethra to the vagina, and vice versa. Okay, it's important to understand how you wipe carefully. Okay, now if you go straight to the walls of the vagina here, they are fibromuscular, very muscles. These muscles are skeletal in nature, 10 centimeters long in inactive states. Okay, during sexual intercourse, when the lady is sexually activated, this becomes elongated, secretory in nature, elongated. So you can take any other pen. Okay, but in terms of rape happens when this 10 centimeters long pen is forcibly entered, so it can destroy the cervix, even the orifice and everything. But the lady is not ready for sex, so it becomes very short and then can be destroyed. Because certain structures over there can be destroyed. Okay. Now, if you look at the pathway carefully, from the walls, you come to the first furnace. That's the anterior furnace, and then you go to the posterior furnace. So, in case of rape issue, the posterior furnace here can be torn open. Okay, the posterior furnace here can be torn open. Okay, so apart from the furnace aspect, we have the cervix. The cervix is the ending part of the vagina and the beginning of the uterus. The cervix is poorly innervated, made up of two types of epithelium: the stratified squamous, non-keratinized, and the simple columnar epithelium. Okay, stratified squamous, non-keratinized belong to the vagina, and simple columnar epithelium belong to the uterus. So during pap smear, when you take epithelium from this end, this is the two types of epithelium you're going to see. When you see any other type of epithelium, either squamous cells or columnar cells, it means the person is prone or is getting the cervical cancer. The cervix is poorly elevated, though very important for the female reproductive system, but it's poorly innervated, such that if something happens to the cervix, the individual may not feel it. So before the individual knows, whatever it is has spread into the vagina, has spread into the uterus. So if you look at the uterus institute too, the uterus has supports. So we have a lot of support for the uterus here, keeping the uterus in position. Okay, so we have the endometrium here, followed by the myometrium, followed by the perimetrium. The perimetrium is the external covering of the uterus. The myometrium is the muscle nature of the uterus, which is smooth muscle, and the endometrium is the inner lining of the uterus. Okay, the position of the uterus is also very important. The uterus has three main parts. That's the fundus, the body, and the corneus or the cervix. Okay, the position of it is very important. We see because of the support, the normal uterus position is antiversion or antiplected. You see, antiversion or antiversion means that the fundus is lying on the urinary bladder. So anterior flexion or anterior version. Okay, anterior to it. So when the person is pregnant, the fundus quickly prolongs or stretch into the abdominal wall. Okay, anterior abdominal wall. Okay, but the other type of position of the uterus, which is approximately 20%, not very common, is a retroverted one. Okay, when the fundus of the uterus lies on the rectum. Okay, for these people, when they are pregnant, it is good eye to see because the protruding or the increasing uterus prolongs or is on the rectum. Okay, not on the anterior abdominal wall. By the time it comes to the anterior abdominal wall, it means the person is at term. So these are the positions and then the aspects related to the uterus. So the support of the uterus can be compromised with age, such that the uterus can drop into the vagina and comes out. We call it prolapse. Prolapse. Okay, we can have rectocell, water within this. We can have cystocell. We can also have PID. PID means the space between the rectum and the uterus is known as the recto-vaginal pouch. Okay, or it's known as recto-uterine pouch of Douglas. Recto-uterine pouch of Douglas. Okay, or the recto-uterine space. Okay, that space usually we can have collection of fluid in that space, and because the two tubes of the uterus opens to that space, it makes it easy for infection to enter the tubes, inflame the ovaries, enters the tubes, and affect the whole lining of the oviduct or the uterine, the fallopian tube. When it's like that, fertility is compromised. When the follicle is released, it forms in a pool of water. So PID, or we can also have salpingitis. Salpingitis is when the tube is all inflated. Okay, so these are the clinical relations related to the tube. Now, if you look at the picture here on the screen, you can see that this is a cross section of the pelvic of a female. Okay, this is the space that I was talking about, the space between the uterus and the rectum. And we can see the ovary and the fallopian tubes or the oviduct opening to the posterior area. So when you have fluid here, the fluid enters the oviduct or the fallopian tubes. Okay, so remember that the ovaries and the fallopian tubes opens into the pouch of Douglas or opens the posterior part of the uterus. So this is the bladder. So the space between the bladder and the uterus is uterovesical or vesicle uterine pouch. Okay, it's not as bigger as the one between the rectum and the uterus. Remember, the oviduct opens at the posterior part of the uterus. And when they ask you the true pelvic structure here, we can see the urinary bladder, the uterus, and the rectum. You can also have the ovaries, the oviduct or the fallopian tube, and then the supporting ligaments. They are all true pelvic structures. Okay, this is the pelvic brim, and you can see structures outside the true pelvis or in the false pelvis. And take also into consideration the wall of the trunk. There's the anterior wall, lateral wall, and the muscle that meets up the wall. Okay, so let's quickly revise the female reproductive system, the gross anatomy. We said that the female reproductive system here has the urethra. We saw that the urethra is just 4 centimeters in length. Lemma for the urethra is the clitoris. Just beneath the clitoris, we have the urethra. Okay, and then we know that in lithotomy position, we have the vestibule. The vestibule is laterally made up of the minora and majora, and the inside we have the orifice of the vagina and the clitoris on top. Again, at that particular aspect, we're also interested in the mons pelvis, and I've asked you to go and find mons pelvis solely in females. We have the pelvic surfaces padded with fat. What's the use of the mons pelvis? Please go and find out. Okay, and then there's a difference between the labia majora and the minora. The majora is made up of a lot of hair follicles, and then the minora is devoid of hair or hair follicles. It's very vascularized, very pinkish in nature, and between them we have the orifice of the vagina. Okay, so we also proceeded and look at the uterus. We said the uterus is made up of 3. It has parts. You have the fundus, the body, and the cervix. The cervix is the ending part of the uterus at the beginning, the ending part of the vagina at the beginning of the uterus. Endometrium is the inner part of the uterus, myometrium, the muscle part of the uterus, and perimedium, that is the surrounding or the epithelium that covers the uterus. Okay, and then we went further to look at the spaces between the pelvic. We say that we have the rectal uterine patch of Douglas. That is the biggest space within the true pelvis. We can also have PID happening there. That is pelvic inflammation disease, fluid accommodation there, and then the oviduct also opens at the posterior part of into the patch of Douglas. Okay, so the true pelvic structures here, we have the rectum, we have the uterus, we have the oviduct, we have the tubes, we have the ligament, the supporting ligaments, and the urinary bladder. The false pelvic structures will have the intestines and other aspects outside the true pelvis. And then we should take note of the wall that made up the anterior wall, the posterior wall, and then the lateral wall of the trunk. The ovary, remember, we say it also opens at the posterior parts of the uterus, or the ovaries are hung at the posterior part of the uterus. So this takes us to the end of the gross anatomy, a quick revision of the gross anatomy of the reproductive system. If you have any question or any comment, you can put it at the comment section. I'll reply you gladly. But you should also note that cervical cancer is on the rise, so we should take advantage of our knowledge of our service and take good care of our service. Ladies of reproductive age, ladies who are sexually active or giving birth before, are advised to also screen their cervix once in a year to do away with this. Men, PSA, secretion of the prostate once in a year. Thank you very much for your attention. If you have any question and any contribution, you can put it at the comment section of the channel and I'll gladly reply you. Until then, please study your books, take your books very serious and take these videos very serious. And then we meet again next time. Bye-bye.